Excellent. It shows us live on both YouTube and Facebook, so I'll begin to share this out momentarily. Perfect. And I already see a couple folks hopping on. Please go ahead and just bear with us as I share this out. Make sure that you're giving us a thumbs up or comment so that I can give you a shout out here momentarily. Awesome. Okay. Well, I think we're going to go ahead and get started. I know we have a lighter Monday, so I want to make sure that if we do have any questions that come up, we take a moment to address those and any other comments that we get our way. I do see Counselor Seymour. Good morning, Counselor Seymour. Thank you for hopping on. Wayne Anderson, Parker Brown, and a few others. Tara, good morning to you. Thank you guys for tuning into our Monday morning broadcast. For those of you that are just now tuning in for the very first time, please make sure that you start following the page. You can hit the like, hit the notification so that you can get notified when we go live. Of course, if you're a returning viewer, thank you for coming back to us, and make sure as you are learning some of the information or maybe gathering some resources that you're also distributing out to your community as much as possible. You can do that in one simple way, and that's by clicking the share button on this video so others in your network are familiar with the resources and information that we want them to be aware of right now. So most of you know me already. I am Juliette Abdel, President and CEO of the Westminster Chamber of Commerce, and I'm always delighted to start off my Mondays. This has been my one consistent way of starting out since COVID. So I am very grateful and fortunate that we always have Mondays with the mayor. Of course, Mayor Atchison provides us with not only COVID updates that are here in our city, in our county, our state, and some additional resources on comments on what's going on in our community. So as he is sharing that information, I'll do my best to type that into the comment section and try and grab that for you all. Make sure that as you are watching, if you hear something that you did not know about and wanted to remember it and type it into the chat section, or if you had a compliment, a good morning pleasantry remark, or any questions, whether they're related to the content or something else that you want us to take a look at, use the comment section of this video to engage with us. Now, I'll go ahead and start displaying some of those comments that we're getting our way. I see Wayne Anderson tuning in on YouTube. Good morning to you, and thank you for that message to both the mayor and myself. I also see Counselor Bowles has hopped on to the broadcast. Good morning, Counselor Bowles. Thank you for coming on. And of course, Counselor Seymour, thank you for tuning in on time to our broadcast today. I see with us Parker Brown. Parker, we were just talking about your amazing restaurants moments ago. So hopefully you'll get to see my face sometime this week. And then I see our existing board chairman right now, which is Peter Brissett. Peter is also logged on and tuning into the broadcast. So thank you, Peter, for being with us. And Emilio Valdez just snuck in here before I even realized it. So thank you, Emilio, for tuning into our Monday morning broadcast. So as you all are starting to tune in, please do us a favor and give us a quick thumbs up or comment so I can see you and see your name and recognize that you're taking some of your morning to learn what's going on. So Mayor, I know I always take up a good chunk of our broadcast, so I want to make sure that I leave the time for you because that's the main draw for today. I'm going to mute myself, and I will have you take it away.
All right. Well, good morning, everyone. And as always, Juliette and I are always trying to make sure we get you the most current information that we can. If there are questions asked that we don't have an answer to on the broadcast, she and I usually communicate quickly after that, and she's able to follow up on the broadcast that she's doing and get that information out to you. Talk about a couple different things. Juliet just failed a very important test a few minutes ago, trying to get her to tell me what tomorrow was. And she said, well, it's February 2nd. I said, yeah, but what is that? Unfortunately, at the youth that we have today, just don't understand these old things going on.
The youth pay attention to what days we have off. The additional ones are just, they're just added perks on the calendar that we have.
Well, as a reminder, tomorrow is Groundhog Day. So whatever you do tomorrow will probably repeat several times during the day. Gentlemen, this is your warning. February the 14th is coming. It's on a Sunday. Remember those special people that you are supposed to remember. Don't mess it up. Reminder also on the 15th of this month is President's Day, and there will be no city council meeting that week. So we'll have one less study session this month, but we will always maintain the 2 city council meetings. For those of you leading into Christmas, Ash Wednesday is on the 17th. So let's talk a little bit about what's going on here in the city. Juliet and I were talking, the test site at Fat Cats continues open on a daily basis, 7 days a week. We're still hearing that there's good usage. I don't get regular repeats out because the county doesn't send us any updates on it. We usually talk about it on Wednesday. So again, COVID testing sites are important. Our vaccine numbers continue to go up throughout the metro area. There seems to be a very successful mass vaccine that took place over the weekend down at the Coors Event Center and a couple of other smaller sites. And Parker, it's 6 o'clock. From 8 to 6 is the number I have had in the past. To that point, we had over 10,000 seniors 70 and above that were vaccinated this weekend between the sites that were done. So that's a good move. Our big concern with vaccines still continues to be the amount of vaccines available. We continue to get numbers from the federal government on what's going to be shipped, and lo and behold, when we get here, we don't have the numbers. I know that one of our health providers this past week was hoping to get 4,000. They requested 4,000, told they would probably get 1,500, and when they got here, they were less than 500. So the big question continues to be, where is the vaccine? We have sites, we have capacity to give many more people to move through the various stages, but we don't have the vaccines to give out. So that has continued to be the single controlling point of getting our numbers to a greater concern. Let's talk a little bit about what happened on Friday. On Friday, the Department of Health called a last-minute meeting to talk about a new COVID dial chart. Comments were allowed up until 5 o'clock today, but very little notice about the fact that this was coming. However, we anticipate that the new COVID dial numbers will go into effect on Thursday of this week. So let me explain a little bit about what's in the proposal they're having. So if we think about the various color stages, red, orange, yellow, blue, green, as you can imagine, the red previously was that anything over 350 was considered to be in the red category. When the new COVID dial goes into effect, that 350 number has now moved to 500. The orange category, previously 175 to 350, will change to 300 to 500. Yellow, previously 100 to 175, will now move from 100 to 300. And then, of course, blue will move from 0 to 75 to now greater than 15, but less than 100. The other thing that's going to change on this is the positivity rate. In the yellow, there's no more than 7.5%, which was previously 10%. And in the orange category, it will drop from 15 to 10. Now, what do these do for us? Capacity-wise, not a lot, but it allows the greater breadth of numbers and infections to be to lower levels. So it won't be as hard to meet. In our information, we have to also look at, previously you had to be at a level for 14 days. That's now going to drop to 7. The county must meet all the metrics of the more open level for a 1-week period. A county is eligible to move into the level if they would like to do so. And a county is eligible and would like to move into a more open state should notify CDPHE by letters signed by the Public Health Department. Now, counties also have the option of staying at a more restrictive level. We know that Pitkin County has moved itself into a more restrictive level due to the numbers that there has. What does it do for us as far as our businesses and restaurants? By moving to this, the capacity level doesn't change in the various levels, but what it does do is allow you, if you're part of our 5-star program, either as a restaurant or a business, to always operate at a level below where the county is at. With this bigger spread of numbers, it allows our counties to move down sooner. Let's talk about where we're at with the numbers. On the 25th, Adams County was at 398 with a 6.6 positivity rate. On February the 1st, Adams County is at 339.1 with a 6% positivity rate. Looking at Jefferson County, on the 25th, they were at 352.6 with a 4.9 positivity rate. On February the 1st, they are at 287.3 with a 4.4 positivity rate. What that shows is all the actions and precautions that you have been taking as the general public, whether as a business or a private citizen, it's working. It's bringing our numbers down. We're well below the 300 mark and the 350 mark. We're continuing to see a downward trend in positivity rates and infection rates. Those of you who are already into the 5-star program, where you were at orange, you will possibly be at yellow. As these numbers continue to go down, if the county moves down, you move down. Keep in mind, though, if the county moves back up, you have to stay at the level below the county. So it's important to me that as many of our businesses as possible get open. We know that there are some that are waiting to see what's going to happen, but I think it's in your benefit. It doesn't cost you anything to go ahead and get into the 5-star program, regardless of what county you're in. Yes, it takes some time. It takes some preparation. As Parker can tell you, it takes you filling out some paperwork. Paperwork went through. He got his inspection. It took less than 15 minutes. And then he was approved for the program. So that gives you a wider ability to operate. It gives you more opportunities to open up your business, return your people to offices if possible. But in any case, you still have the COVID social distancing and the numbers to be careful of. I am not advocating that you force people to return who are not comfortable. We have a long way to go with vaccines. And until we can get past the stages that we're at and start to get our teachers, our critical workforce, a lot of our workforce is not considered critical today, but need to be back on their jobs, but also to get more of our seniors vaccinated. But also we still have the ability to get into senior living facilities. Some have not had anybody in there, some here in the state. We need to get that vaccine growing, but we need more vaccines. We believe that a third vaccine will go for emergency approval later this week. The difference is that one has a one-time shot, but the efficacy rate is lower. That one is only in the 66%. And when you go into the higher numbers, it gets at best, it gets to be about 72%, where the other two, Pfizer and Moderna, are in the 90s. Doesn't mean that you shouldn't consider those if and when it comes out, but sometimes it's the ability to just say, I want to get one shot and I'll take the level of risk for between the other two. Everything that we have seen says that they are effective, but we are seeing a growing number of infections here in the United States, starting in Carolinas, now in the California area, of the African and the UK variant strains. This thing continues to mutate. We get new strains, and as fast as they can be identified, the World Health Departments, the CDC, and our local health departments try to monopolize what they can to deal with that strain to see how effective it is. So far, none of the new strains that have been identified cannot be helpful with the vaccines. We haven't seen anything come out that's been reported either nationally or locally that says we have no vaccines that will work against this strain. Does that mean it's not going to happen? No. It just means we have to be vigilant. We have to continue to test. We have to continue to look for opportunities to make sure that we're doing everything we can to control the spread and to get as many people vaccinated as soon as possible so that there's some level of protection regardless of what strain it is. Beyond that, I think we're pretty set to be a very light agenda on the council calendar. We have one item other than our COVID report, and then we have a continuation of an item that was deferred from last week due to the late hour that we were already at, and we were still having items to discuss, so we'll finish that up tonight. Again, reminder, we will be short one meeting this month, sorry. So we'll only have one study session that week tonight. The next 2 weeks, other than the President's Day, will be devoted to council meetings. Again, that's a continuation of what we're doing. It's about 18 after. We've got some time for questions or comments. I've been trying to watch the comment section. I haven't seen anything other than Parker asking about the operational hours. The hours at Mayoral, I think, are still 8 to 7. I may be off a little bit there. It's best to check the website in the county for the confirmation of what they're doing. I'm not aware that they have reduced their hours and that they are still operating on at least a 5-day week balance over there.
Absolutely. And what the mayor is referencing, and you've made a lot of comments, so I know that I've been trying to capture as many of them as I could into the comment section. For those that are hopping on here with us, we have Mayor Atchison, who's provided us a number of items. He's touched on 5-star program. He's touched on the new COVID framework that will likely come out, the new dial that's there. He's also gone in detail on a few of our different testing sites, touched on some different celebratory holidays that are coming up, and obviously the importance of supporting local when you can during that time, and some of the things that they will be doing through council over the next couple of weeks. So if you are just now hopping on and you have any questions, now is the time for you to be able to type them into our comment section, because that is where we pull all of them from. So with that being said, I just wanted to do a quick recap because we did have Parker asking a few questions, and I know the mayor was answering that along the way. Parker is on here with us, and he was asking, as it relates to the Fat Cats location, what the time of Fat Cats is. The mayor has shared the timing for that. We've also included a link to the original post on the City of Westminster site that discusses the COVID-19 testing site over at Fat Cats. This was the most recent site that we've opened in partnership, of course, with Jeffco and support from the state approval that's there. We've also discussed about how the Waterworld location is still operational. So if you are interested in getting tested, those are a couple of different ways that you can. We've had with us COVID Check Colorado as well in one of our broadcasts. And if you are a business that is trying to set up some sort of a mechanism to test your employees as you're bringing them back, like the mayor is saying, then you should consider looking into that, because they do allow for a dashboard. So you can actually see, what employees you send when to get tested, and you see the results and can kind of monitor whether you want to create a policy that checks up on people along the way and make sure that they are healthy and safe for your customers as well. We've also gone in detail on COVID case count, which I'm so glad that today's broadcast is discussing how great of a job we're doing. They are going down on both Adams County and Jeffco. The mayor has provided us a nice comparison. So what he generally will do is share numbers from over this last week and then compare to as of today. And you can see that we've consistently gone down between the case count and the positivity rate. Those have been included in the comment section of this broadcast. And what I've also done was include the links to those health department websites as well. So if you're interested in information on the Tri-County COVID-19 cases, those updates, you can find the link in here. Similar with Jeffco, you can also go to jeffco.us/public health for any of those direct details. Looks like Dave Carpenter also hopped on and provided us with a nice good morning note. Thank you, Dave, for hopping on our way and tuning into the broadcast. I'm just going to quickly skim down here and see. It looks like Peter has a question for us, and so
yeah, I can pull it up. I'll read what's on the chart for you.
I'm looking for it right. Oh, there it is. I was like, I just saw it and it went away. Okay, so Peter's question relates to CDPHE, asking about the COVID dial. So if all of you are hopping on here right now, the mayor was discussing as of last Friday, there was a meeting that he was involved in and kind of was familiar with the information that was being discussed and shared. The concept is that this new dial is coming out that would change some of the numbers on the different categories from red, orange, and yellow. These also would be the ones that we're using when we're considering the 5-star programs for both counties. So Peter's question is a relevant one, and why change a dial that's been out there and we've been actively using not only as a county and a state?
So Peter, let me answer this. This is the data that they gave us at the meeting, and they have 3 bullet points. First is to provide the ability to better balance disease suppression with economic hardships due to increasing vaccinations and decreasing disease rates, making the dial framework more responsive to local conditions, and accounting for the benefits to hospital capacity from the vaccination of people over age 70 and frontline healthcare workers and adjusting metrics. That's the basis of why they went in to modify it to give it a broader opening to allow more business to operate and to look at what's really going on. I think you will probably see, as they've indicated, they're going to look at another adjustment to the dial in the spring, probably in the March timeframe. Again, it's going to be dependent upon what happens with vaccines and vaccinations. But anyway, this opportunity is to get that even more open as we go forward and we see the results of vaccines and continued hand washing, distancing, and mask wearing.
Absolutely, and thank you so much for that, Mayor. Peter did want to go ahead and just share with you a quick thank you. For those of you that are hopping on, Peter had a question as it relates to the new COVID-19 dial that will be coming out later part of this week that it adjusts for 3 different factors. Mayor has gone over all of those into the broadcast. So that was one of the comments that we received. It looks like Wayne also had a quick comment for us. Wayne is tuning in from YouTube. So at the very same time that we're streaming this on Facebook, of course, our videos are being streamed on the YouTube channel. You can find them in the video section at any point in time to rewatch. Now, Wayne is providing a quick thank you for the information about the vaccine and that he has been on the Kaiser virtual line for about 2 weeks. So it does reemphasize, I know the mayor went into discussion about the vaccines and the biggest concern right now being the number of vaccines that are available to the select classes that can get them at the same time. So I think Wayne's comment is probably a nice compliment to that message that you were just sharing earlier on, Mayor.
Yeah, to Wayne's point, Kaiser has been the one name that has floated to the top more than anyone else. And the fact that they've been very slow in reacting to the calls and responses to the senior population, the lack of returning calls, the inability for a lot of those things to happen. And that's one of the reasons the state also went to the point, especially for some of our seniors who are not computer literate or don't have the ability to navigate the internet system, is to have all of our major providers establish a phone line and to put it on their websites where people can call in and talk to a human being and to set up the appointments themselves. I know on the KOA this morning, I heard a number of seniors who had been in that situation that once they got to a phone number, they were able to get in and get appointments at least, where they have been very frustrated about the ability to have to try to deal with the internet. And they very well admitted they were not computer savvy, they didn't like the internet, and they tried to do what they could not to have to do that. So at least now we have phone line options for people to go to.
Excellent. Thank you so much for that, Mayor. It looks like we also have Councillor DeMott that has hopped onto the broadcast with us. I also see Debbie. Good morning to you, Debbie. And I see Christina. Thank you guys for hopping onto the broadcast. We have with us Mayor Atchison, and he is providing some updates and information our way. Just wanting to pull up those quick comments from some of those guests. Councillor DeMott was sharing a nice good morning message. Same for Debbie. Thank you as well, Debbie, for hopping on and tuning into our broadcast. So Mayor, we also went into the fact that with February having a Monday that falls on President's Day is recognized as a holiday, so our city offices will be closed around that time, similar for Chamber as well. So as you all are aware, generally Mondays are either city council or study session, so this month will be one shy as far as study session. Today is a continuation of discussions with one new item to discuss at city council. And I'm going to say that the reason you went slightly over was because we did not put the pressure on Catherine, on Councillor Scully, to make sure that that meeting ended. I mean, the last couple of weeks, she has made sure that you guys are out there at a decent hour.
Well, I have to give her the credit. We said by midnight, and we got out just before midnight. So she
Excellent.
did meet her goal, but
Yes.
she got it pretty well squeezed down to the time limit.
She did. Good for her. I'm so glad, for sure. And then we also touched on a number of other areas. We discussed the 5-star program for Jeffco. So those businesses that are interested in applying to that program, applications are open right now. They were initially open for restaurants solely. Now they are actually taking in for personal services. They're also taking in for indoor events as well. And so if you are interested in applying to the 5-star program, which is a relatively easy process, Parker, I know last time shared that you guys can connect with him. He is always viewing on here and would be happy to answer any questions. The Chamber and the city are both heavily plugged in, so you can always direct them our way as well. The Jeffco website is included into the comment section of this broadcast if you're interested in filling out about any of the paperwork for the 5-star program. It's incredibly as easy, I'm going to say as easy as most applications that I've seen on any of the government sites. So if I'm saying that, I can tell you it actually is in comparison. Adams County still has not received the approval from the state on their 5-star program, although they do have their pilot program information on their website as well. So if you are a business that is in Westminster but operates on the Adams County website, we've included the link for the Adams County page into the comment section of this broadcast as well. The mayor did go in detail on the importance of the 5-star program. If you are in the program right now, and what we mean by in is obviously these counties are kind of operating in between what the state has said and where we hope to go with our numbers, and this newer dial and newer shift will allow us to be more in congruency. So if you apply and you then move through the inspection process, then you go on the approval list, and then once the county moves to that official level, then you can operate under it by one level. So it does kind of act as, I want to say, insurance and a guarantee. So if anything were to transpire later on, you can be ahead of the curve by still being able to operate at a different capacity. So I know that was quick-winded, but I wanted to comment on that. The mayor also talked about a third vaccine that is looking to come out soon. It's a 1-shot instead of the 2-shot approach that Pfizer and Moderna both have. This one would have a efficacy rate of, I think, 66%, Mayor, is what you referenced, up to 72%. But that seems also higher than even flu shots. I think we talked about that before.
They're done in the 30 to 40% range in the flu shot. So this is still a good thing.
Yes, so this is still double, if not more, the ability for it to combat anything as it relates to COVID. So if you're interested in those vaccines and we're curious about the development of it, that's something that's coming along the way for that. Okay, I'm seeing if there's any, I don't see any other questions that are on here, Mayor. So if you don't have anything, then I'll go ahead and start closing it out, if that's okay.
One short item.
Yeah.
We have to go back to one of our members here, and that's Parker Brown. I wanted to thank Parker for the donation he made to the medical team over at North Suburban. He is sending some meals over for our hospital workers and stuff this week. I think that it's extremely important to recognize the healthcare workers who are putting in extraordinary long hours, many hours beyond a normal shift week. And Parker, thank you very much for taking the time and the effort to make sure that they get a little something to recognize their efforts. We had a chance to visit with the North Suburban team last week. I'll be doing that tomorrow with the Good Sam team to thank them for the work that they're doing. And a lot of what they're having to go through is terrible, seeing patients come in that don't get to go home. But for North Suburban, they have already processed and sent home over 1,000 people who came in with COVID that they've been able to help get over that and then send them home. Unfortunately, there's been also a large number of people who didn't get to go home. So thanks again, Parker, for what you do. Thank you for being a part of our community.
Thank you so much for that, Mayor. I had no idea, but it's no surprise. Parker was our Westie Achiever over this last year, and it's because of his strong, open heart and investment in the Westminster community. And this just goes to show that he continues to do that through support of our frontline workers. I also see Sarah Nermella. Thank you, Sarah, for hopping onto the broadcast with us. And thank you, Mayor, for going out there and letting our hospital providers know how incredibly valuable they are, especially during this time for us. Believe it or not, we are over our 30-minute mark, so I have to make this a short and quick ending. So if you are hopping onto this broadcast right now, this video will be available at any point in time for you to rewind and rewatch and replay. If you watch it and we are much later, give us a hashtag replay so that I can find your comment and any additional questions that you might share our way. If you did not get a chance to ask us a question, maybe were hesitant to do so in front of an audience or had an additional comment, you can always DM our page directly or email us at info@westminsterchamber.biz. And as the mayor shared, him and I are in active discussion. So should we hear a question or a comment that we need to provide you with substantial information about, we will come back and do so in a timely manner for you. Make sure that you share this video out to others in your network and know that the videos are available for replay all the way back into March of 2020. Believe it or not, we are nearly to a year of doing this. And like I said, this has been one of my positive sides to everything that we are in. So thank you to the mayor for being on here with us, for being able to share some of these updates. Of course, to all of our counselors that continue to tune in and engage with us, we appreciate that support. To our businesses that are staying as resilient and strong as possible, thank you for doing your part, for making sure that your employees and your customers are as healthy and safe as possible during this rather difficult time. And of course, enjoy the rest of your week. We will be back on here for future broadcasts, so stay tuned for 11 a.m. broadcast throughout the week. Thank you, Mayor.